Wilmer Carter for today's hearing. One bill has been removed from the calendar. That's item number 3, AB 822, at the request of the author. That bill will not be heard today. And so at this juncture, we're looking for authors. And so if the sergeants could call the authors' offices, and that would be Mr. Portantino, Mr. Ma, and Mr. De La Torre's office, so that we can commence the hearing.
Nava's presenting for De La Torre.
Okay, we're going to call item number 4, AB 1225, which is Mr. De La Torre's bill. At the request of Mr. De La Torre, Mr. Nava will be presenting the bill due to Mr. De La Torre's absence. Welcome, Mr. Nava. The floor is yours.
It's a pleasure to be here, Mr. Chair and members. This is Assembly Bill 1225. It ensures that state and local preparations for public health emergencies are as thorough as possible in order to protect the public from infectious disease outbreaks, including the recent emergence of H1N1 virus. Specifically, this bill requires that the Department of Health Services and local health department conducting preparedness simulations for an infectious disease outbreak identify deficiencies in their plans and track the implementation of any needed corrective action. An August 2005 report by the Bureau of State Audits found that while each surveyed local health department participated in preparedness exercises related to infectious disease on emergencies, none included any policy or specific procedure for preparing after-action reports. State regulations require the completion of after-action reports for declared emergencies within 90 days. However, there is no requirement for preparing after-action reports for an exercise or a drill. I believe the state should take common sense steps to ensure that California's preparedness plans address all potential scenarios, and would respectfully ask for an aye vote.
Very good. Do you have any witnesses, Mr. Nava? Apparently not.
It's obvious the merits of the bill are so overwhelming that
Yes, everyone
none
stayed
were
home.
needed.
Anyone who wishes to speak on behalf of the bill, any witnesses or those who wish to testify in opposition to the bill or raise any concerns, questions from the committee? We have a motion from Mr. Block. We don't have a quorum yet, though. So Mr. Adams has a question.
Thank you very much, Mr. Chairman. Mr. Nava, just a couple of points of clarification about the legislation. Some of the concerns that have been raised about it in our analysis are the duplicative work that's being done. And speaking to the author's office, I got the sense that the idea here was to try to make public that which is already being created but is an internal document. I was wondering if you can expound on that, tell me if that is in fact what you see the bill as doing, and also speak, if you would, to some of the concerns raised about the potential cost that might be borne by the state as a state mandate.
Well, let me give a brief explanation of my understanding. What we have here is the DHS has taken action to clarify its policy on the reports, but the Bureau of State Audit still expressed the need for the department to refine its policy further by developing and implementing written tracking procedures to ensure it addresses all relevant recommendations that it identifies in the after-action reports, which gets you part of the way there. But unfortunately, there is no requirement that there be after-action reports when there's been an exercise or a drill that has been conducted. And so you have the benefit of the experience, but you don't have any documentation that would give you the direction on how to improve it. And on the issue of costs, you have... Okay. The explanation that I received is all they're asking is that the reports be made public. Since they have to prepare them, there shouldn't be any additional costs.
And this is the thing that concerned me, because in talking to their office, and I appreciated their staff's time and attention on the matter, I don't see in the language itself exactly where the mandate to publicly disclose an internal document actually is, and I was wondering if you could help me to identify that.
Thank you. You know where it is?
So while you're answering that question, let's establish our quorum. Let's call the roll.
Jones?
Here.
Fletcher? Here. Adams?
Here.
Amiano? Block? Here. Caballero? Conway? De La Torre? De Leon? Emerson? Here. Gaines? Here. Hall? Hayashi? Here. Hernandez? Lowenthal? Napa?
Here.
Perez? Salas? Strickland?
Sir?
Yes. Mr. Adams, you raised an excellent point. There isn't any language in the bill that addresses what you have just identified. And so Mr. De La Torre's office is certainly prepared to make the changes to the bill to clarify that.
I appreciate that. And with that in mind, I'm willing to support the bill. I would like to see that included, that since that was the author's, I perceive the author's intent
Yes.
based on their staff.
Thank you.
Thank you.
I had a question as well. The analysis reflects that the bill is silent on the entity to whom the bill is submitted. So I'm wondering what the author's intent is in that regard, because the bill doesn't say who the report is to be given to. The report gets prepared, but there's no indication as to who the report is to.
The report will be returned to the local health departments because it is the local health departments have the obligation for carrying out the remedial steps.
Okay, so that would be a useful thing to clarify in the bill, because there's nothing to that effect in the bill. Mr. Gaines, do you have a question, sir?
Great, thank you. I'm just looking at our analysis, and there's a question here in terms of, I guess, potential for an amendment that would remove the state-imposed mandate on local government, and I don't know if that's been addressed or not.
Apparently, the author is interested in having that conversation about the additional amendment.
Okay, great. Thank you.
Thank you.
Okay, so I guess the question is, there were two, several questions, but there were two indications of amendments that might be taken. One was in response to the question Mr. Adams raised, and then I had a question about the clarifying who the report is submitted to, and you indicated it's the local public health department. So I guess the question is, are we getting a commitment to take those two amendments? We don't have to take them here. If we can take them at some other point, that's fine. But
Okay. It's my understanding the next committee is appropriations, and the author staff has indicated a willingness. I do think that Mr. Gaines brought up a point that wasn't rejected by the author's staff, that it be incorporated with respect to the local mandate issue.
okay, well, that's three then. Good. Any other questions from members of the committee? Okay, Mr. Block moves the bill. Is there a second? A second from Mr. Adams. Is there any further discussion by members of the committee? Mr. Nava, would you like to close, sir?
Ask for an aye vote.
All right, let's call the roll.
Jones?
Aye.
Jones, aye. Fletcher? Aye. Fletcher, aye. Adams? Adams, aye. Amiano? Block? Aye. Block, aye. Caballero? Conway? Conway, no. De La Torre? De Leon? Emerson? Gaines? Hall? Hayashi? Hayashi, aye. Hernandez?
The amendment.
Hernandez, aye. Lowenthal?
You got the amendment.
Nava?
Aye.
Nava, aye. Perez? Perez, aye. Salas? Salas, aye. Strickland? That's 9. Needs one more.
Okay, that has 9. It needs one more vote. We'll put it on call. And thank you, Mr. Nava. And that motion was due pass and re-referred and refer to appropriations. So that measures on call. Let's call the next item. So we're looking for Ms. Ma, item number 2, AB 223, and we're looking for Mr. Portantino, item number 1, AB 113. If the sergeants could call the absent members. It's my intention, members, to close this committee down at 2:30. If we don't have authors, I may close it down before then. But if you could let the authors' offices know that we're not going to stay here indefinitely. It's our intention to shut this committee down in about 5 minutes if we don't have authors present. Ms. Ma, welcome. So we're going to call item number 2, AB 223, Ms. Ma's Safe Body Art Act. Welcome. Okay, please, members, direct your attention to Ms. Ma, who's going to present her bill at this time.
Thank you, Mr. Chair, members. This is a bill that I presented last year that the governor vetoed. The veto message was basically he felt that the cities and counties already had the authority to create guidelines and standards for this industry. However, we know that all the cities and counties, including the 4 additional jurisdictions, are crying out for standards that at least they can follow minimum guidelines. And there are certain cities and counties who may want to create additional standards above and beyond this minimum, but at least it gives them some sort of guideline to follow. So Assembly Bill 223, the Safe Body Art Act provides comprehensive statewide standards for tattooing, body piercing, and the application of permanent cosmetics in California. Since 1997, the number of body art practitioners has skyrocketed by over 400%. Since then, repeated calls from health practitioners, established body art practitioners, and body art trade associations asking for stricter guidelines and regulations and clarification on enforcement have gone unanswered. California still does not have enforceable statewide standards. Without AB 223, current law allows backstreet tattooing and piercing in unsanitary facilities by unregistered practitioners. Because of the repeated calls for stricter regulation, I am reintroducing the Safe Body Art Act. And as I mentioned, the governor vetoed it, stating it was not necessary. However, we are back again, hoping to prove that this is necessary. This will protect the health of both body art consumers and practitioners, and will provide local authorities an effective avenue for enforcing these standards. Here with me to testify in support of the bill are Justin Mallon, California Environmental Health Administrators, Dave O'Connell, a local tattoo artist from Sacramento, and others in support.
Mr. Chair, members, thank you very much. Second time round, hopefully you can do it quickly. I wanted to stress a couple of points. Justin Malone with the Environmental Health Directors, we're the folks that are in the street. We're the folks that protect you from food safety, all the other environmental health programs. And this program has defaulted to the local environmental health folks. Over the past 10 years, you've got a hodgepodge of local programs that is not adequately protecting the public. It's not consistent, and it's clearly not good for business. Because as you'll hear from the industry themselves, they want this. This is a collaborative effort. We have industry support. We have folks like the blood bank, medical practitioners. We have the health officers, environmental health officers, and we have virtually everybody that's a stakeholder in this industry is in support of this bill. At this point, we have no opposition except the governor. And I wanted to stress how we're going to address the governor's concerns. Firstly, the governor, as the author mentioned, the governor said that this was not necessary. It's necessary. The industry wants it. The local regulatory agencies want it. This doesn't impose a dime worth of obligation on the state. This isn't going to cost the state a dime. All they have to say is locals go and do it. Here's some standards. You apply the standards. It's not a new mandate. We're not creating any new regulatory burden. This is nothing new. It's already in place. It's a botched job, and we're trying to fix it. So right now, we want to protect public health. You got earlier this morning examples of how it can go wrong. We've got some good operators here, and I think they'll talk to how they do it properly. We want to ensure there's regulatory consistency. This is a big issue on both sides of the aisle. Whatever the regulations are, they need to be fair and effective. And we also want to level the playing field for the businesses. It's clearly not fair that people that do it right can have their industry undermined by backstreet tattoo artists or piercers. And we want to stop that. So we urge a bipartisan support for that. We got some Republican support. We hope that we can send it to the governor. If you have any issues, we're happy to address them. As I say, this has been a collaborative effort. All the stakeholders have been in support. And if there are any concerns, we'd like to get both sides of the aisle in support of this measure before we send it back to the governor. Thank you.
Okay, we'll hear from one other principal witnesses, and then the others can identify themselves. Who's next?
Go ahead.
My name is Dave O'Connor. I own Sacramento Tattoo, and yeah, there's a lot of shops out there that are doing stuff not too healthy and not too clean. And I see a lot of people coming in with problems, bad tattoos, minors coming in that were tattooed not good. This bill is, there's a lot of good stuff in it. I'm about 98% behind it. There's a few things in there that are a little bit overboard, but for the most part, it's going to be good for the industry. Thank you.
Thank you.
Lydia Bourne, representing the Blood Centers of California. We represent the 18 nonprofit centers throughout the state, and as such provide over 90% of the blood and blood products. With the passage of AB 223, we will be able to tap into a huge potential donor base, whereas now we have to defer them because they're getting tattooed to pierce in unlicensed and uninspected facilities. We ask for your aye vote.
Thank you. Other witnesses in support?
I'm Bill Lorenz. I work at Sacramento Tattoo. I agree that there has to be some kind of regulations on tattoo and body piercing.
Thank you. Others in support?
Bruce Palmer with the Health Officers Association of California, co-sponsors and strong support.
Other witnesses in support?
Mr. Chairman, members, my name is Mike Knutson. I represent StudX, which is a California-based company that makes almost all of the ear-piercing equipment that's used, frankly, throughout the world. And I would characterize our position as diligently working towards support. In this committee last year, the particular issues surrounding the piercing of the ear, what I would call modern or retail ear piercing, weren't really addressed. We worked with the author in the other house, and they did a very good job, and we removed our opposition at that time. We're just looking to maybe perfect the language just a little bit and look forward to supporting the bill.
Thank you. Any who wish to testify in opposition or raise concerns about the measure? Questions from the committee? Yes, Ms. Conway.
Thank you, Mr. Chairman. Ms. Ma, is this become a local mandate, or is this a cost for local governments to implement this, or what's your take on that?
I'm going to have Mr. Mallon, but...
Yeah, I can respond. As I mentioned, the actual enabling legislation was passed in nearly 12 years ago, AB 186. So the mandate is already there for local health officers and environmental health because they share this responsibility. The mandate's already there. Our programs are entirely fee-for-service. So a local jurisdiction already has to register under state law the body art practitioners. The problem that we've been having is the inadequate guidelines that are given to locals and this disparate set of standards that have been established in 62 local jurisdictions. But we collect our costs through fees, so when we permit a facility like the Sacramento one, we get a fee for that service that we are providing for licensing them or permitting their facility.
Yes, and as of 2008, only 6 of the 62 cities and counties with public health and or environmental health agencies have comprehensive local programs that register and inspect body art practitioners. So this is a need. There are some that are more proactive, but for the most part, the majority don't have any sort of registration or regulations.
Mr. Hernandez.
Thank you, Mr. Chair. And Assembly Member Ma, I want to thank you for taking on this issue. It's unfortunate that the governor did veto the bill last year, and hopefully with what you're doing this year, we'll get through and get a signature. But I also understand there had been some opposition in the past, as well as you're working with some of the opposition now. And I would encourage you to continue to do so and to kind of hopefully address the ear piercing industry as well. So, but again, thank you for all the hard work you did.
Okay, seeing no further, Mr. Gaines.
If I could just get a question of clarification from Assemblymember Ma. Mr. Knutson raised an issue. Is that something that's going to be addressed in terms of ear piercing? Or?
Maybe I could if I could. Our issues in the main have been addressed. Now that we're going to do this again, we have a couple of clarifications that we've talked to the author's office about, but this was looked at carefully and was in the main dress last year, and we're looking at just a couple of minor clarifications, and we expect to formally support the bill.
Very good. Great. Thank you.
So I just want to remind the members, this vote enjoyed 77 votes on our floor, and the author has committed to work with everybody involved. So if there are no other, I think we had a motion from Mr. Fletcher and a second from Mr. Block. If there's no further questions from members of the committee, the motion is due pass and referred to appropriations. Ms. Ma, would you like to close?
No, I think if we said everything, unless people want to hear some of the potential significant public health risks like HIV, AIDS, hepatitis B, C, bacterial, viral infections, et cetera, et cetera. So thank you very much, members.
We saw some very good photography already,
good.
Which is
My
causing
show and
some
tell
of us to lose our lunches. With that, we're going to call the roll.
Jones?
Aye.
Jones, aye. Fletcher? Aye. Fletcher, aye. Adams? Amiano? Block? Aye. Block, aye. Caballero? Conway? Aye. Conway, aye. Ruskin? De Leon? Emerson? Gaines? Gaines, aye. Hall? Hayashi? Aye. Hayashi, aye. Hernandez? Hernandez, aye. Lowenthal? Nava? Aye. Nava, aye. Perez? Salas? Aye. Salas, aye. Strickland? Aye. Strickland, aye.
That is 10. It's out. Congratulations. We're going to call next item number 1, AB 113, Mr. Portantino's bill dealing with mammographies. Welcome, Mr. Portantino. And you can be as brief as you'd like.
I urge an aye vote.
There we go. Okay, are there any witnesses who'd like to speak in support of the bill? Thanks, Mike. Any witnesses in opposition to the? Oh, there are some in support. Here we go.
Shannon Smith Crowley, American Congress of OBGYNs, in support.
Okay, any other witnesses in support? Okay, any who wish to testify in opposition or who raise concerns? Mr. Portantino has 2 other bills in 2 other committees, so we're trying to move quickly. Questions from members of the committee? The committee has seen the bill before. Anything else you'd like to elaborate on, Mr. Portantino?
We are going to be taking some co-authors in the next committee, including Mr. Fletcher. Obviously, federally, you know that there's been lots of uncertainty with mammography. This bill is timely and important and will save lives, and I respectfully ask for an aye vote.
I'd be happy to be added as a co-author. Any others who wish to add on as co-authors? Mr. Block, other members? You have a question, Mr. Gaines. Go ahead.
Because if I could, we've seen this bill before.
Yes, sir.
And it was vetoed?
Yes, sir.
Could you clarify, has there been any changes made to it based on the response by the governor?
No, and I think the governor is looking at, frankly, wrongly, that this is a mandate. It is not. It is simply asking women who are qualified to get extension of that benefit that they already receive. It clarifies, it doesn't mandate, in our opinion.
Okay. All right. Very well. Thank you.
Okay, do we have a motion? A motion, Ms. Hayashi, a second from Mr. Block. Any further questions from members of the committee? And seeing none, would you like to close, sir?
I ask for an aye vote.
Let's call the roll.
Jones?
Aye.
Jones, aye. Fletcher? Aye. Fletcher, aye. Adams? Amiano? Block? Aye. Block, aye. Caballero? Conway? Conway, aye. Ruskin? De Leon? Emerson? Gaines? Gaines, aye. Hall? Hayashi? Hayashi, aye. Hernandez? Hernandez, aye. Lowenthal? Nava? Nava, aye. Perez? Salas? Strickland? Strickland, aye.
What do we need? 9.
Okay, that is 9. It needs 1 more.
Okay.
Okay. So with that, we are concluded the business of the committee. We've got 2 bills on call. I'm going to lift the call on those 2 bills in about a minute to give the authors a chance to try to get the absent members here. But it's not my intention to keep this committee open indefinitely. Okay. Okay, so I'm going to lift the call on Mr. Portantino's bill, which is item number 1. Ask the clerk to call the absent member.
Adams. Aye. Adams, aye. Amiano? Caballero? Ruskin? De Leon?
Item number 1. Chair recommends an aye vote. Bill dealing with mammographies.
De Leon, aye. Emerson? Hall? Lowenthal?
Thank you, Mr. Portantino.
Perez? Salas?
That is 11. That bill's out. Okay, we're going to lift the call on item number 4, AB 1225, Mr. De La Torre's bill. Let's call the absent members.
Amiano? Caballero? Ruskin? De Leon? Aye. De Leon, aye. Hall? Lowenthal?
Okay, that bill is 10. That bill is out. And Ms. Ma's bill was out earlier. Mr. Fletcher pulled his bill. So with that, if you'd like to add on, you may do so at this time. With that, we are concluded our business here.